guys, it's Sarah, and I'm shaking. I'm coming at you for my week 103 VSG post-op VSG update, and week 19 pregnancy video. I don't have a super duper lot to talk about today, just a few things. So I will just jump into the numbers. I started my journey on April the 26th, 2012. At that time, I weighed in at 357 pounds. I think the last time I came to you, I was back down to 176. This week, I'm actually back up to 186. I think it's been like a couple weeks since I made a video, so that's kind of a 10-pound gain. I actually was up at the doctor's office, and I was actually, according to their scales, 200 pounds. So, yeah, how do I feel about that? Very depressing. Do not enjoy it. Not loving it. But my scale, I'm still well under 200, so I am just going to stick to that number. And I really thought about asking them not to weigh me, but I know that they have to do that for certain purposes. But it's still very upsetting. And I was afraid she was going to say something to me about my weight, even though I had lost weight the previous time. Then I made up for it this past time. But she didn't, and I am excited about that. So let me think what I want to talk about. Okay. Well, when I went to the doctor yesterday, and it was my my next checkup. I don't know. I go every 4 weeks. And everything looked good. She comes in really quickly. At this point, they have not. I've only done blood work on me once or twice. They haven't done any blood work lately. I'll get some again when I go back next time. And she asked me. She just comes in, asks if I have any trouble, and I said no. We did have an impromptu ultrasound. The last visit, excuse me, they had told me that they're going to bring me back in 4 weeks. And then they'll bring me back in at another week and a half, 2 weeks, because then I would be 20 weeks. And at that point, they would do the 20-week ultrasound on baby Oz. And I was like, okay. So even when I made my appointment with the appointment girl at my last appointment, she said, just a regular visit, right? And I said, yes, just a regular visit. And so my husband has been going with me most visits. He couldn't go last time. And I have been like, there ain't no sense in going. You're not going to miss anything. And so he was able to come, thank goodness, because when I got there, I looked at the girl, because normally I go in, I sign in, and then they say go to the lab. And so we've already started paying our deposit on the baby, because with my insurance, like, we know already how much it's going to cost to have the baby. If I have a baby naturally, vaginally, not C-section. And if it is C-section, that's a whole different cost, but still, it's not. I'm making payments for the baby. Blech. So, I feel really out of breath, sorry. Which I know is normal. So, in that time, so when she said, and I said, so you just want me to go back to the lab? This is after I made my payment. And she went, no, you won't go to the lab till after your ultrasound. I said, I'm not having an ultrasound today. She said, yes, you are. I said, no, I'm not. And she said, yes, you are. And at that moment, I freaked out. And I said, my bladder's not even really full. So I ran out to the car, and I grabbed my water, and I just start chugging. Now, chugging the best way that I can. Because, yes, I can drink way more than I used to could. And I'm not just sipping, but it is still, I can't just chug. So, and my tummy really wasn't right yesterday, and honestly has not been super great today. I think it's just from the crappy eating on Sunday. And honestly, I didn't eat a whole lot Sunday, but I did not make the best choices, and I snacked off and on. So, yeah, and I've been having really terrible heartburn, which knows baby. And, like, my pain yesterday was, like, all in here, like where I was uncomfortable, so I know that's my actual tummy, and I think it's heartburn. Anyways, so, yeah, ultrasound was good, everything looked good, everything she saw was good, And, you know, I knew they were checking, you know, the heart and the brain and like to make sure the kidney and the bladder and all that was still there. All that was in working order. And everything looked good. And I said, so if you see something bad, are you going to tell me? Or will they bring the doctor in? And she said, well, it really just depends. But she said, a lot of times we want the doctor to inform you if there's something going on. She said, but it depends on what it is. So everything looked fine. I don't think I told you guys, but the cystic fibrosis testing came back, and Ed was not a carrier. So we're in the clear there. They offered me other genetic testing yesterday. They offered me this thing called the Harmony that will test for like Down syndrome and some of the trisomies to see if I could possibly be a carrier of those. And I really don't know how because they test the baby too somehow. I'm not really sure how that works because they're not directly getting it unless they do like a amniocentesis. And then there was something else called AFD that would test for spina bifida. And I had kind of been thinking it, but we made the choice yesterday not to get those genetic testings done because I know an amnio is something I do not want to do. So if we were to get those tests back and they were positive, we would just have 4 or 5 months of worry. And you know, at this point, we know that those things could possibly happen. It won't change my mind. I would not have a abortion, and I would also, you know, it wouldn't make us love the baby any less. So, you know, the only positives in those would be that we could have a better idea of what potentially could be waiting for us on the other side. I do live in a small community. It's a college town, but it's very, very small, very rural area. And so that would have really been the only positive and even then we wouldn't know. We would just know that it's potential, it's really a real potential that we would have to ship the baby off immediately after it was born. And you know, even without those things, something like that could happen. So I asked Ed what he wanted to do, and he said it didn't matter to him, it was up to me. And you know, it's not going to change anything. And so there's something I would do different if we found that out, other than worry. So I just made the choice not to have those testings done. Okay, so the weight gain. Last week was awful. I promise I'm not going to cry. Last Sunday, my best friend informed me that her husband was very seriously considering a job in Nashville, Tennessee, which is about 3.5 hours from where I live. And if you know anything about me or have been involved in my journey at any point in time, you know how involved I am with my best friend and her children. When she travels, I have her kids. And so the potential for them to move, and then on top of that, pregnancy hormones, I'm sure, was a really horrible week. I pretty much cried all day, every day, from Sunday to Thursday, which is when kind of things were more resolved. He did start the job Monday, and they will be moving. But I think as of this moment, it's just really bad timing. They are going to be, her and the kids are going to stay till next May, after Cash finishes 3rd grade. That's the plan right now. Now, I love them, but I know them, and things could change very quickly. But he had a 30-day trial at this job anyways, and then, you know, she kind of wanted to give him time to be 100% sure this is what he wanted before they just completely uprooted the kids. I will also tell you that I've had to change the way I think about it because Cash knows now. It really wasn't intentional to tell him this early, but you know, they had to tell him about Ray not going to be home a lot. And so then he just hysterically cried and asked, were they moving? And so it has just been a very emotional week for us all. Those kids are my heart, and I feel like they're mine. So it's been very, and I know some things we're going to have to change just because Oz is going to be in the world. But we would just make adjustments to that. So yeah. And you know, they're 3 hours away. And I can get to them very quickly if I need to. 3 hours is not that bad. I'll be really, really upset if it was like 12. So, but anyways, we kind of had to slap on a happy face for Cash and really talk him into it. You know, when an 8-year-old looks at you boo-hooing, crying, and saying, "Will you please move to Nashville with me?" It was really rough. Really rough. He is just amazing, and he's so smart and very, 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 very sensitive and smart. He's just such a smart kid. And the things that were coming out of his mouth were all things that I'd been thinking, but I just never imagined that his little 8-year-old brain would be thinking those things, and they were. And so, you know, it's going to be a hard transition on all of us. I don't know. Anyways, so last week I did not focus on anything pretty much but feeling sorry for myself. I think I've already talked about this, but I'm basically trying to make the healthiest choices that I can, but I'm not denying myself anything. My current craving is sour. I've never been a candy person, ever. But if it says sour on the package, I am buying it and trying it. Although I've been really disappointed because nothing is sour enough for me, and I'm really like, so, yeah. What else do I want to talk about? That's basically it. I did want to talk about one other thing, and I may give you a body shot. Let me just talk really quickly about Sarah Nardin, Oregon, her goal video, which completely hit home. And I've sort of talked about this on and off. I really wanted to be in the 160s. My best friend keeps telling me, you know, unless you have that skin removed, that's not going to happen. She's afraid I'll be sickly. That after this baby comes, that is something I will work towards for sure. But, and I've talked about this in recently videos, I've hit goal. I claim it. I have hit it. This is where I wanted to be. You know, pregnancy is what got this, infertility is what got this ball rolling. I mean, that's where we are. It's not a number. You know, I'm healthy. I'm having a healthy pregnancy. My blood pressure was good this week. When I went back to the doctor, you know, I was kind of concerned about that the last time. This is what I wanted. When you go back and watch those first videos from me, that's what I'm talking about. You know, I want to be healthy, but ultimately, I just want to be a mom. And, you know, that's what got this ball rolling for me. And here we are, almost 2 years post-op, and I have a baby. And it is just the biggest blessing. The biggest blessing. I've gotten to feel the baby kick a few times. I was kind of unsure at first that's what it was. It only happened a few times, and he was really active yesterday on the ultrasound, his sweet little hands and feet, and it's just amazing. I mean, this is exactly where I wanted to be and what I wanted, and you know, 186 is not so bad. You know, 200 at the doctor freaked me out completely, but you know, I'll deal with that. I'm so healthy, and I know that. And even if I'm making crappy choices some of the day, I'm still really healthy and just exactly where I wanted to be. So I am standing with Sarah, and I am claiming goal because that's exactly what I am. That's what I wanted. That's what this journey was all about. So I don't think that was a big shocker for anybody. Better? Not really. Okay, so I'm going to try to back up. I can't really get that far. And that's it. This is basically as far as I can go. And I do have on like a loose top today, but I was going to try to smooth it down for you. So I do have a little bump. It feels like a big bump. I feel hugacious, and I was just reading something this week that said, if you think you feel big now. But I'm wearing some tights and this loose top. Saturday, I had on this a maternity top, and everybody was like, oh my goodness. So there he is. There's Oz. I've been feeling crazy because I still have that little crease here on my fat roll. And I've been reading stuff about where the baby's supposed to be, and I've been getting really upset because I feel like I'm poking out here. But you know, yesterday where she was finding him was like here, you know, up here, like in close to the crease. So I know I'm not crazy, and I know I'm thinking eventually it's going to completely pop out. But yeah, so I'm excited. I'm exhausted still. Very little nausea anymore. But I feel really good. So 19 weeks. I'm almost halfway there. Freaks me out every time I think about it. But it is definitely a boy. Did I say that? I know we knew that. We thought we knew that. But I kept having the back of my mind thinking it was a girl. And I am so tickled that it's a boy. So, okay, guys. We'll see you later. Bye.